Hello, I'm Joyce Harper and I'm Professor at the Institute for Women's Health at University College London. And with Alpesh Doshi, we run the Embryology and PGD Academy. And I'm very pleased to introduce you to Module 3 of our certificate in clinical embryology. You can take this module standalone or you can take it as part of the full certificate. And Module 3 is titled Genetics, Pre-implantation Genetic Testing and Prenatal Diagnosis. So I'd like to start by introducing you to the faculty. I am going to start off with the talks, giving the introduction, which you have here, and then an introduction to genetics, genetic disease, chromosome abnormalities, and reproductive genetics. And then Professor Darren Griffin, who's also worked on PGT since the beginning, is going to talk about the genetics of infertility. I will then continue with 2 lectures. The history of pre-implantation genetic testing, which formed the first chapter in my 2 PGT books, and then I'm going to give an overview of pre-implantation genetic testing. And then we're going to have 2 talks on embryo biopsy. Very pleased to introduce my co-founder, Alpesh Doshi, who will give an introduction to all 3 stages of embryo biopsy: polar body, cleavage stage, and blastocyst biopsy. And then Georgia Kokoli, who is one of the pioneers of blastocyst biopsy, will talk about the practical aspects of embryo biopsy. Now, no module about PGD would be complete without a talk by Professor Alan Handyside, the pioneer of this procedure. So we're very pleased that he's going to talk to us about the genetic diagnosis of PGT. And then Roy Naga, who works at iGenomics and worked with us at UCL for many years, is going to talk specifically about PGT for aneuploidy testing. And then we're going to move on to prenatal diagnosis, starting off with Ageliki, who's going to talk about non-invasive prenatal testing, NIPT, and then Sarah Hillman, who works again with me at UCL and University College Hospital, is going to talk about invasive procedures of prenatal diagnosis, including amniocentesis and chorionic villus sampling. And the genetic counselling talk is going to be given by Karen Sage. And finally, I'm going to talk about the controversial and ethical issues around pre-implantation genetic testing, but also non-invasive testing and the future. So the aims and learning objectives of this module are to educate candidates on the basics of genetic disease and the genetics of infertility, to understand the theory and practical aspects of embryo biopsy, to understand genetic testing for pre-implantation genetic testing, and to understand the basics of prenatal diagnosis, and to educate candidates on what is going to be discussed during genetic counselling. And finally, to consider some of the ethical issues around reproductive genetics. Now, with our other modules, there is a logbook for this module. If your clinic is doing embryo biopsy and you're doing the full certificate, then you can complete the logbook, which includes biopsy preparation, preparing the micromanipulator and preparing the cells, embryo biopsy, tubing cells, and validation. And Alpesh Doshi and I have produced videos to support you in some of these techniques. So that's the module on genetics, pre-implantation genetic testing and prenatal diagnosis. And we really hope that you enjoy it and we look forward to your feedback. And if you want to take the full certificate, please visit embryologycertificate.com. Thank you very much.